The next one we all know, we just don't know it by name. Halitosis, a fancy name for bad breath. And of course, the dental handpiece is that drill that we use to remove tooth decay. The high-speed handpiece and the slow-speed handpiece. The handpiece is a working horse in the dental office. And I'm sure you've heard the word implant before. It's a new buzzword. Now, the implant is the man-made replacement for the root of a tooth. So if you have a missing tooth and you want a tooth replaced where the space is now, the oral surgeon will put in an implant in that bone that will take the place of your natural root. It will function as a root on which we can now build a tooth. Okay, so the implant is the man-made replacement of the root of a tooth. Itis, gingivitis. Itis means inflammation. So if you see it at the end of a word, you can kind of figure it out. Because if you know gingiva is gum and itis is inflammation, you can put it together and say gingivitis, inflammation of the gingiva, right? Jaw. You know where your jaw is. I don't need to tell you. You have an upper jaw and a lower jaw. Yeah? And then we're going to speak about lingual. Lingual refers to tongue. So if you have the lingual surface, it means it's on the tongue side. Anything to do with lingual means tongue. And then we have mandible. You have an upper jaw and a lower jaw. The lower jaw is known as your mandible. And your upper jaw is known as the maxilla. Okay, we're moving on. Nitrous oxide. Nitrous oxide is also known as, you guessed it, laughing gas. Sometimes it's used to relax the semi-sedate patients so that, they're more at ease while dental treatment is being done. So nitrous oxide, laughing gas. The operatory is a fancy name for the treatment room. So when we're speaking about putting the patient in the operatory, we're talking about putting the patient in the treatment room.